Hello, my name's Taryn McGinn-Valley, and I will be presenting this talk today, Indigenous Women's Reproductive Health in Guatemala, Contraception and Access in San Lucas, Tolimán. So to start, I will be talking about San Lucas, Tolimán, which is a small town on the shores of Lake Atitlan in southwestern Guatemala, and you can see it with the heart here in the slide. The vast majority of the population of San Lucas, which is 30,000, is Indigenous. And the average daily income in San Lucas is below $3 per day. So we got involved with this project because health promoters who are involved with an Indigenous collaborative of community health workers collaborated with us on preliminary research project in 2019, and their hope was to develop a community health worker-led women's health intervention. And particularly to the question of contraception in Guatemala, Guatemala's Indigenous communities do have higher birth and maternal mortality rates than non-Indigenous Guatemalans, and significantly, there's continued inequities in access to care in general and access to contraceptive care in particular between Guatemala's Indigenous communities like San Lucas and non-Indigenous communities. So we conducted a mixed method survey that was based on the internationally administered DHS maternal and child health surveys, the last of which was done in Guatemala in 2014. And we interviewed 62 women with this mixed method survey. The ages span from 21 to 65, and the median number of children was 3. We also conducted focus groups talking to 23 health promoters. And the interviews and the surveys covered 5 topics. They covered general health, mental health, family planning, prenatal care, pregnancy and birth, and cancer prevention. But what I'm going to talk about for the rest of the talk is the family planning section. And in terms of analysis, we used a triangulation approach to mixed methods analysis, where we analyzed the qualitative data through inductive coding and the quantitative data through some statistical analysis. We conducted those at the same time, and the findings informed one another and what we concluded. So our quantitative results in the contraception section showed that 51% of women reported using birth control of some kind, and 33% used what we would term as modern contraception. And our qualitative results really added some nuance to this, showing that there's really a conflict between the biomedical conception of reproductive choice and the experiences and priorities of the Maya women that we interviewed, the Indigenous women, around reproduction. And what really shone through was that a lot of the women we talked to feared modern contraception, especially what they were concerned about adverse health effects of hormonal contraception. People talked particularly about being afraid of cancer. So next steps will be to collaborate with community organizations in San Lucas to improve Indigenous women's sexual and reproductive health care. Thanks so much.